an accident.
This meeting is being recorded.
There we go. Brian is no longer working after being involved in an accident at work, which meant that his back was damaged and leading to ongoing conditions and disability as he is now living on benefits. He was working as a cardiology nurse at Glasgow Royal Infirmary at the time of his accident, and before that he worked as a secretary and a PA within the Scottish HQ of the British Red Cross. In Glasgow, he's a volunteer in Access to the Poverty Truth community and has campaigned extensively within Scottish Parliament, working with MSPs to bring them the lived experience of what it's like to live in poverty. His core belief is that every child in the UK should have the same opportunities and development, no matter where they begin on the poverty ladder. He will work continuously to give those trapped in poverty the key to free themselves of the struggle and stigma associated with it. Please welcome Brian Scott to introduce the event.
Welcome, everyone. Well, we're gathering around this round table to mark the United Nations International Day for the Eradication of Poverty. It was on this day, on October 17th, 1987, that 100,000 people gathered in the Human Rights and Liberties Plaza in Paris. We all came together to share stories and experience of poverty, no matter where we were in the world. And on that day, they unveiled a large stone. Today in Glasgow, the Poverty Truth community, along with a couple of other groups, marked this day round a similar stone, which is in George's Square in Glasgow. And I'd like to read what it says that was inscribed both in that stone in Paris and in the one in Glasgow. Whenever men and women are condemned to live in poverty, human rights are violated. It is our solemn duty to come together to ensure that these rights are respected. In the UK, very often we take human rights for granted. We don't always realise that our human rights are being violated. We also don't realise that if we don't use our human rights, then we run the risk of losing them. So that's why events like this are so important. When you live in poverty, you suffer so much violations of your human rights. You have no dignity. And many times when you've been going to, say, a job centre, you have had to describe your circumstances in front of the whole queue. Very private information, very traumatic information, but you have no dignity. You have to share it with a complete stranger in front of complete strangers. You have no autonomy over your life. If you're on benefits, decisions that are made in Parliament hundreds of miles away can have such a detrimental effect on your life, and it can cause so much turmoil and upset that you can physically become unwell, both mentally and physically. So I'd like to introduce you to this roundtable this evening, and I thank all the speakers are going to be speaking today, and they'll put into perspective the experiences of people like myself who have been and currently are living in poverty. And remember that poverty is not just in the UK, it's around the world. And we're fighting for everyone here. And this is why we're coming together to remember. So without further ado, I'd like to hand back to Will and get the meeting underway. Thank you.
Thank you very much, Ryan. In June 2022, we hosted a roundtable on poverty and the rights of the child in partnership with Brian and others from the Poverty Truth community. Our speakers were able to share their stories regarding those that they worked with in poverty and the issues that people faced. We also looked at Scotland's opportunity to further expand human rights law protections by further inclusion of the United Nations treaties into domestic law. This is our follow-up roundtable on eradicating poverty, and we are proud that we're able to hold another to continue to raise awareness of the issues that people in poverty face and look for solutions to these issues. I will now pass on to Aoife to introduce our first speaker.
Thank you so much, Will. I would like to introduce Christine Campbell. Christine is a women's health campaigner and feminist from Caithness and chair of North Highlands Women's Wellbeing Hub. She shares a personal journey with endometriosis and surgical menopause. Under the hub, they run 4 women's health support groups for endometriosis, menopause, general women's health, and period health. They use the hub to raise awareness and are campaigning for safe local services in Caithness. They're expectant mums and women requiring gynecological care are required to travel 100+ miles. This has huge financial impact on the community, and traveling to these appointments causes financial hardship for women living in rural areas. Please join me in welcoming Christine Campbell.
Thank you very much. Is it okay if I share some slides? Yeah, have I got sharing? It's disabled.
Hold on a second and I'll just give you the
Thank
right
you.
slide. No worries.
I just think vision can sometimes tell a story better, so.
Absolutely. That should work now.
It is, can't see my slides though. It's coming up so slow, sorry.
No worries at all.
It's coming up so small on the screen, I can't see where it is. I think I'll maybe just have to leave the slides.
No worries.
What I'll do is I'll open them on my own screen so that I can keep myself right, because if not, I'll go on for all the evening. But thank you very much for inviting me to speak. So I'm Christine Campbell. I live up in Caithness. I've been a kind of women's health sort of champion campaigner since 2004. I was at the actual board meeting where a decision was made about downgrading of Caithness maternity services, and I predicted that we would see a collapse of gynecology in Caithness as well. I sit in a lot of different women's health groups and forums and make sure that we've got a strong rural healthcare voice. I set up the Endometriosis North Highland group back in 2020, and that's when I connected with the amazing Rebecca and Claire. Rebecca is our vice chair and she's on the call tonight as well, so it's really good to have her here. And Claire is our secretary. Claire has a massive passion around the poverty side. She works with a lot of families in Caithness, and we have a lot of areas of poverty up here. So she's incredibly passionate, but she's not a sort of speaker. She's always hides away, so hopefully I will do her justice tonight. So I was lucky enough to get connected with the amazing Claire McGilvery last year, and since then she's turned myself, Rebecca and Claire into human rights defenders, and we've just had quite an amazing journey. So we founded the North Highland Women's Wellbeing Hub back in June last year. It's a not-for-profit, voluntary-led, and we use our lived experience to run the organisation. And under it, as we've already said, we've got the 4 support groups, which has got about 700 group members now. And we raise awareness, and we're campaigning for safe local care as well. So it's really good. So just so that you get a quick sort of update on what a Caithness situation is. So back in November 2016, we saw our maternity downgraded to a community midwife-led unit. So we used to have 3 consultants here in 24/7 service, but now we just have 1 gynecologist on sort of part-time hours left behind, so there's no emergency care. It's consequently reduced our local births massively. In the EQIA, which is full of a lot of misinformation, it stipulates that it would be a small reduction in births, but 200 a year down to just 8 last year is a lot more than small. 5 of that births actually took place in our A&E department as well, which is not suitable as well. We're seeing a massive increase in mums-to-be choosing to have either a caesarean section or induction because they do not want to travel in active labour, and who could blame them? So if you're going from Wick, it's about 100 miles, but if you're in Chonnagroats, that's another half an hour, and so on and so forth. So it's a long distance. And what I'll maybe do is I'll maybe share slides so that you can send out to everybody it's on the call so that you can see visions of a distance, because it is huge and area, you know, it's so rural that if the weather changes, it can suddenly change. You could be heading up the road and suddenly you're on the snow gates that's closed. So yeah, it's quite a horrendous. But unfortunately, it's not just maternity and gynecology. We're seeing a massive decrease in everything up here. Most of the clinics that we had are now in Inverness, which is having a huge financial impact on many, many residents up here. And often you go for these appointments and they're only for 10 minutes. So it simply isn't good enough. So yeah, the journey itself can cause a lot of issues. So if you travel by car, you get reimbursed 17 pence per mile. And if you aren't claiming any benefits, you automatically lose £10. So it's a hit financially. It's precious loss of annual leave. Annual leave should be used for rest, and a lot of people up here are using it to go for hospital appointments. If you were unlucky enough to hit a pothole, you might end up with a puncture, chip a windscreen, broken spring. It could end up being a really costly day out. And then if you've got an early morning appointment, or if you can't fit in with the transport, because transport is quite poor as well, you might end up having to pay to stay overnight. Inverness is one of the fastest growing cities. It's one of the most expensive cities that you can go to stay in. NHS Highland reimburse you only £50 a night, whereas I've just looked on booking.com a little while ago to see what it is for tonight, and the cheapest is £130. So it's a big hit for anybody. And there is a severe lack of suitable accommodation. Occasionally, there is Kyle Court available, which is by the hospital, but it's booked up quite often. So yeah, it can be really quite difficult. But yeah, so it can be a massive, massive impact. And then when you live with a long-term health condition, it is exhausting to go at distance and back in a day. So it could actually shatter you then for 2 to 3 days later as well. So it's not all financial, you know, it might then impact work later on in the week as well. So, you know, it's about earnings as well. It's a horrible, horrible situation. We're also seeing a massive increase in women choosing to go private. And this is because Caithness used to do a huge part of the gynecology operating lists. And now it's all been done in Inverness. So a list now to actually just be seen for a consultation is 19 months. And when you're living with a condition like endometriosis, to wait that for a consultation and then wait again for surgery, it's soul destroying. So we are seeing a massive increase. And again, for skill set, so we have seen women starting to put themselves in debt of up to £5,000 to £10,000 for suitable treatment. And that's just not good enough. And then there's always like hidden costs as well. You know, if you need childcare, if you need food, if you need to stay, or even for your lunch, then if you end up having to stay, if surgery doesn't go according to plan, you end up having to stay longer. You might need to buy more clothes, toiletries, pet care, childcare. There's just so many hidden costs that nobody thinks of. And women are the absolute worst. We never put ourselves first. We'll always put our family first, our friends first. And we might have more caring responsibilities as well, which makes it awkward. So then you've got to choose whether you can sort of afford the time away from your family to go to his appointment. It's really soul destroying. And it's just not good enough. But I will definitely share my slides because we've got some really good ones. And we've got hoodies now that we have for the hub. And on the back, we've got women don't have standards. If women don't have attitudes, we have standards. So thank you very much. That's a really kind of quick roundup of the situation up here in Caithness.
Thank you very much, Kirsty, for sharing. We'll make sure that your slides get circulated.
Thank you.
I am pleased to welcome our second speaker. Hannah Kirby is a community development worker at Inspiring Leith, an assets-based community development project at Bethany Christian Trust. She's been working with residents in a social housing high-rise building in Leith for the past 5 years and has supported them to take a human rights-based approach to housing problems, successfully campaigning for improvements to the building. She has recently completed a master's in adult education, community development and youth work at the University of Glasgow and focused on human rights and community development approaches to community health and refugee and migrant integration. Joining Hannah is Kirsty Chatwood, who is a resident and community activist who has lived in the building for 16 years and was the chair of the Residents Association in the past. She now leads on bookstores, gardening, and is very involved with the community forum. Please welcome Hannah and Kirsty.
Hi, everyone. Thanks so much, Kirsty. That was so powerful to hear and just absolutely shocking. Thanks so much for sharing. Yeah, my name is Hannah and this is Kirsty. I am a community development worker with Inspiring Leith, which is based at Bethany Christian Trust, which is a homelessness charity. And we're going to explain a little bit about starting to use a human rights-based approach in the building. I've been working in the building for about 4 years, and Kirsty has lived in the building for 16, is that right? Or is it more now?
19 soon.
19, yeah. And she was one of the first people that we met when we first started working in the building. And this is just a bit of a chat about how Colin and I, my colleague, we started working using kind of a assets-based approach to community development. So getting to know people and helping them do activities that they wanted to do. And as we kind of heard more about the really shocking housing situation in Cableswynd House, kind of moving towards more of a human rights based approach and kind of what's happened with that. Again, Claire McGilvery's been involved, so it's a common theme. Cableswynd House, or otherwise known as Banana Flats, is a social housing building in Leith. It has 212 flats and 8 floors, and it was a really important kind of mass housing building after the war. It has the same listing as the castle, as Edinburgh Castle, because it's a really good example of brutalist architecture. A lot of people have really good memories of growing up there, and there's proud Leithers, there's New Scots, there's people who have their first home after being homeless there. It's in a really good location. Kirsty, can you say a bit about what you like about the building?
So first of all, Leith is a really, really fabulous place to live and to raise kids in, because it is extremely multicultural. There's so many activities and things. But as with everything, Edinburgh Council's systemic and structural investment in Cableswynd and lots of other council properties across has caused quite significant distress, physical and mental health for tenants. But in particular with the building, because of the way it's arranged, you can only access properties on 3 landings. So you have sort of 80 people on your landing. So you have lots and lots of neighbors sort of to meet. And we've got really, really great neighbors and lots of lovely kids, regardless of what other people say. Just amazing. They're quite big for council flats, and they have more storage than any new build has. There's lots of that. I personally have a view from Arthur's Seat all the way across to Firth of Forth that you can't knock. But yes, no, it's a great place, but you know, it is with everything. The fact that it's not been invested in has caused problems.
Yeah,
it is unfortunate because it is really a great building to live in had they cared for it properly.
Cool, thanks, Kirsty. And yeah, I suppose the other side of how great it is as you've mentioned, underinvestment, and also just it has got high levels of income deprivation and child poverty, and And that's a kind of significant part of life for a lot of people there, as I'm sure you've seen too, haven't you, Kirsty?
Yes.
So when we started working at Cable's House, Kirsty was one of the first people that we met. And as I was saying, our way of working then was with the belief that a lot of the solutions and energy and change that is often needed in a community that is under-resourced is already in the people that are there, because there's so many talents, so many interests, and so much lived experience there. So we started by doing gardening. Kirsty wanted to do a wee community garden, and we did lots of stuff with the children, craft stalls, book stalls, and we did things during lockdown as well. And through the pandemic, we also offered kind of one-to-one support with people, but it was quite slow getting to know people, because we found that when we first started working at the building, some people were so discouraged, especially by the kind of conditions of the building. They would say things like, well, you know, good luck to you, but I'm moving out, I'm off, you know, like I'm not going to stay here for very long. But lots of good things did happen. And this is another example of Marai here. She's a Zumba instructor, and just as we were coming out of the second lockdown, she got in touch and said she wanted to start a Zumba class for her neighbours. So we kind of helped her get that set up. Kirsty, could you say something about what the book stalls and the swaps and the gardening kind of means to you, and why that's important to you?
Yeah, so I've been involved for so many years now with different groups and things in the building, so I do know quite a lot of people. But it felt like when we were meeting up with people, running into them in the lifts and things, that everybody only had negative things to say, particularly during COVID. And we have, because of the way where the building's located, we do have a problem with people who have addiction issues or homelessness, sort of trying to stay in the stairwells. And so we've had a lot of problems with like needles and people urinating in the stairwells. But when Hannah and Colin came along and started helping fund the gardening, it was great fun. We actually got some of the boys like 12, 13, and 14 who you don't hang out in gardens, coming and digging up potatoes with us, and worms and snails were big ones for some of the younger boys. And we made squirrel feeders and all sorts of things, and bird feeders. And a lot of it, because of the council and investment in the building, it really did depend, I have to say, on the financial support of Inspiring Leith. In terms of the book stalls, we started giving them out once a month for the kids. And I didn't really think at first it would be as big as it is, but we've had kids come along and recite their favorite poetry to us. I was once given a kung fu lesson using a plastic recorder, but the kids, you know, they want to hang out in the building, and they're enjoying, and they like being there. They like being with us. And so it increased, because the parents weren't really sure that it would work, but it's increased the number of kids coming through to us. And so we did in the summer a fun fair where we got the council to fork out for a bouncy castle, which was nice. So that was a really great experience for the kids. We do Halloween trick-or-treating. And so all of those things we've managed to target the children. So a lot of parents are now becoming more involved, because before that they just said there was nothing to do, there was nothing there. And now in targeting the kids, we've got large families coming along. And I mean, our building, we do have 3 generations of families living here, people who moved in when they first got married or when the building just opened. So we do have like a massive population who've had bad experiences with the council over the years, but are becoming more and more positive now with these kinds of activities than they ever have had in the past. And certainly we get more support from tenants as well.
It's been really important for just people getting to know each other, hasn't it?
Yes.
And from my point of view as an outsider, all of those activities were really great to get to know people. And I suppose as a community development worker, I'm always listening to what people are saying about their lives. And a turning point for us was one person sort of who didn't really want to do the gardening, because they said, like, what's the point of gardening when the stairwell stinks of urine and I'm too ashamed to have anyone over? And I think then it kind of became so clear that the actual state of the building was having a really big impact on people's willingness to like participate in life and to have people over, and on people's mental health or physical health. And that's when we kind of moved towards with residents starting to take more of a human rights based approach. And so the difference with a rights based approach is kind of this panel principles, so participation, accountability, non-discrimination, empowerment, and law. And I suppose what we've been talking about is the participation has really grown over the last few years of people just knowing each other and wanting to do things and being involved in things. But the accountability wasn't there at all, because there was no residents group. And people were so discouraged they would hardly ever fill in things from the council, and the participation in that way was really low. And there's a lot of people with English as a second language, or don't speak English in the building, and also who have various disabilities and health conditions. So non-discrimination is a really big part as well. So moving towards a human rights-based approach, what we actually did, and this was with the help of Making Rights Real, and also we invited Shelter Scotland to become involved, which really helped the sort of accountability as well. But these are some of the first posters of some of the residents, including Kirsty and a few others, restarted a residents group, and then our friend Stacey, who lives there, had an idea for kind of a community forum where it was residents and the police and councillors and political representatives all coming together to try to make Cableswynd a better place. We also had a local councillor come and walk around the building, and we also designed a survey together with the residents, and we spoke to about a quarter of people in the building. And these are some of the response. This was last year. Some of the good things about brilliant families living there. Some people were really, really happy. But a lot of people mentioned just the impact of the kind of building itself, and that it was just being so neglected, and how much of an impact that was having on them. The particular things that came up were kind of the levels of repairs and how long people had to wait for repairs, or people would book in a repair, someone would come, knock on their door, and by the time they'd gotten to the door, they'd have gone away, and then it wasn't rebooked, and lots of things like that. People without hot water, people just waiting on really important repairs. And as you can see, says that people who were waiting, over 50% of them said the repair was having a big impact on their life. Other people have mold. The lifts have been a really big issue, because so many people on the higher floors absolutely depend on lifts. And when they break, it's a huge kind of issue for disability rights. Pests was another one. And then just communication, with people not really feeling very informed of what was going on in the building. So we shared some of the results with the council at the forum. And I think with the kind of level of accountability increased, the council had already they're working through the high-rise buildings in Edinburgh to redo them. But I think Cableswynd and Linksview it really started moving very fast, and the council have now decided to fully retrofit the whole building, which should hopefully have a really amazing impact on a lot of things like the mold and the lifts, things like that. which is an amazing impact when the residents have started to come together and say, you know, these are our rights. And we haven't actually linked them to human rights that much yet when they made that announcement. But what we're going to do next is to monitor. We're about to do the next survey, and we'll ask people the same questions and see if anything's improved. And then hopefully we'll be able to see kind of which things will be improved by the council doing the retrofit, and which things perhaps like repairs and maintenance and communication, things like that, we might still need to keep pressing on. But the really good thing about using like the human rights is that we can hopefully link more of what we find to where people's rights are being violated, because especially around adequate housing, that's a really major one for people that affects so much to do with their health and their everyday life. And yeah, so these are some of the these are just some posters that we put up in the building recently, and some of the achievements that the residents have achieved. And then alongside it, we're obviously still supporting Kirsty and others to keep doing all the fun stuff too, because that is so core in people's participation. And if we're not having fun, then it's hard to kind of get engaged with everything else. So I don't know how much time we've got left. I let Kirsty say one more thing. So yeah, is that?
Yeah, absolutely. On you go.
Yeah, so Kirsty, do you want to just say one more thing just about particularly the lifts and kind of the impact that that's had on you and the meeting that we've got coming up?
Yes, so over COVID, the buildings have a lot of mold and no ventilation. And during COVID, when the first vaccinations came out, a stack of us discovered that actually we were all classed as highly vulnerable. So it was like, we joked we're going on a party to the hospital to get the vaccinations. But people were late for their appointments because there was only one working lift, or there was only 2 working lifts. So people couldn't actually get to the COVID vaccinations. People were very, very isolated. And we have a lot of elderly tenants, people with young children, lots of people with disabilities. And so at some point during COVID, we only had one working lift for 400 people. So what we had was people who were vulnerable, and particularly the elderly, wouldn't actually leave the flats. They didn't want to go out to buy milk if they came back to the building and found they couldn't get back up the stairs, you know. And that has been a huge, huge issue because the building itself is in such a bad state right now. We've got no insulation in most of the building. So people are very, very ill, very, very scared about leaving. Quite a lot of people have been diagnosed with anxiety disorders and depression following COVID, and just how unhealthy it was for people to even get out and get fresh air, you know, and you can't underestimate. I mean, we talked about jokingly about lifts being a human rights file, like lifts are a human right. Which seems sort of funny in some ways, but actually for the tenants for many tenants in the building, access to lifts makes a huge, huge impact on their physical and mental health. More so. Sorry.
And I was just going to say, I suppose that recently we had a meeting with the council and at the community forum, and one resident was really able to kind of get across, like Kirsty's saying, the impact that it has, particularly if you're elderly or you have a health condition. And in response, the council are going to bring I think it's the head of housing in that area to hear that impact and to try to see if they can do a kind of, because we've obviously got the retrofit coming, which will hopefully make a massive difference to some of the things, but to maybe it's a kind of process of people actually saying, no, these are our rights, and we're going to kind of hold you accountable, and essentially that's really good for the residents and for the council, because the council actually hear from the residents like this is having a massive impact. Yeah, so we're hoping that might we might get movement on that quite quickly now, hopefully.
Yeah, I mean the refit of the building, we've had sort of refits before, where the council has just not done what their duty required. They failed many at accountability in so many levels. But right now we're actually quite hopeful because the architectural firm who's going to be involved in the retrofit are very much a places for people kind of thing. So it won't just be the building that gets fixed. There'll be the gardens, the play park nearby. They're going to improve. And we've never had the council do that kind of investment. So we're looking from like a community groups, having a community room built in the building for us with an outdoor space. You know, we're very hopeful, but we also have had this before where the council the last refit, the kitchens are falling apart already, and the heating system they put in, a bespoke heating system that none of them can work. If everybody turns their heat on at the same time, the pressure and it goes, and nobody's got hot water or heat. I mean, that is, you know, the basic of our building. If it's cold, the heat's just not going to come on.
Well, so yeah, I hope that gives you a sense of kind of how we've been starting to use like human rights, and that we're getting somewhere with it, but that we'll try to keep kind of monitoring the actual progress. And that's kind of really part of a human rights approach, is like, what impact is it actually having on residents, and trying to involve as many people as possible in that process. Thanks very much.
Thank you so much, Hannah and Kirsty. Thank you for speaking about how, you know, some of the residents you're working with, how they positively encourage interactions with their community, and how human rights is driving and supporting your work and improvements for the residents you work with. That is fantastic to hear. Thank you so much. I will now like to welcome MSP Paul Sweeney. He is our third speaker, well, our fourth speaker tonight. Mr. Sweeney is currently one of the MSPs for Glasgow. He was elected into that role in 2021. In his other political roles, he has served as a member of the UK Parliament and Shadow Undersecretary of State for Scotland between 2017 and 2019, and a member of the Scottish Parliament for Glasgow and Shadow Minister in the Finance and Health portfolios since 2021. He is passionate about advocating against child poverty, noting the effects poverty has on reducing the lifespan of a person and negatively impacting their quality of life. He believes, and I got this quote from one of the articles he wrote, the defining mission of any government, regardless of political affiliation, should be to improve the life chances, opportunities, and prosperity of its poorest and most disadvantaged people. And I just thought that was such a wonderful thing that often gets lost these days. But please do join me in welcoming MSP Paul Sweeney. Thank you.
Thank you so much for the kind introduction, and it's been certainly very interesting to listen to the different perspectives of previous speakers this evening on this International Day for the Eradication of Poverty. And I think this really does cut to the core of everything that we must do in positions of power, whether in Parliament or indeed if you have the privilege to serve in government, because we all have a stake in this. And I think a lot of people have personal perspectives that are often informed by adverse experiences, perhaps from childhood. And that can stem from a number of different interactions where we generally encounter how fragile society actually is. I think people saw a lot of that during the pandemic, when some of the inequalities in society were writ large. And often poverty can manifest itself in a number of different ways, which can influence a person's behaviour for the rest of their lives. So that's why child poverty is so important to eradicate, because it casts such a insidious shadow over someone's entire lifespan. And indeed, I certainly grew up in a family which was working class. And, you know, when my dad, for example, was made redundant, the humiliation of that sudden shock to the family income, going into school and everyone talking about what they got for Christmas, and that you didn't really get anything for Christmas, and having to sort of, you know, either try and talk about these things in a sort of fantasy way, imagining the things you would have got and trying to blag your case. It can be deeply damaging to someone's self-esteem at a young age to then be mercilessly mocked or whatever. These are the ways in which child poverty has an adverse effect. It's not just in the material conditions of someone's existence, it's also in their sense of well-being, their mental health, and that can have a deep and scarring impact through someone's life. And certainly, when I was elected and had the privilege to first be elected to Parliament in 2017, I represented not just one of the poorest constituencies in Scotland, but the entire United Kingdom. And the real glaring disparity in incomes in Glasgow really hit home for me then. And I think it's difficult as a private citizen to fully appreciate the hardship and difficulties that people encounter. Just one example of that was on the very first day I was elected, I held a sort of street surgery in Denniston, and a lady came up to me and was quite distressed, and she talked about how her son, who was in his mid-20s, had been diagnosed with a brain tumour, terminal brain tumour, was severely disabled as a result of this brain tumour, couldn't see properly, his balance was affected, so he was bedridden effectively, but he'd actually been sanctioned by the Department for Work and Pensions, and as a result, had lost income, and his partner was struggling to support them independently. So basically, she was left to financially support her son in a terminal illness, due to the deliberate policy of the government with respect to social security. So we talk about it in an abstract sense, often statistics and percentages and numbers, but you just to hear someone's personal experience in such a distressing situation really was harrowing, but also resolved my own determination to try and deal with this at a structural level. And I think that's never really left me ever since. I mentioned that in my maiden speech to Parliament, that particular case, because it moved me so deeply, but it soon manifested itself in many other different ways. For example, we talk about poverty in the sense of, someone unemployed perhaps, but what was really striking was the level of people who were working and trying to do the right thing, who still were living in poverty, despite doing all the right things that the government supposedly expects of them, yet they were still unable to earn sufficient income to sustain a minimum standard of living. And that's been the case increasingly over the last decade as incomes have stagnated. Indeed, in Glasgow, there are currently 27,995 children living in relative poverty. That has a seriously deleterious effect, not just on those lives, but on the entire city and the community. It has a hugely negative effect. And the most frustrating thing is that this is really largely preventable. I hear all the time about constituents that can't afford to cover the cost of bills or having to choose between heating and eating, and struggling to support even essential items such as school uniforms, and the associated humiliations that go along with that. Living in poverty can be both expensive but also extremely stressful, as has already been discussed. There are countless decisions that have to be made at the margins on very basic things that are related to survival. And this has a profound impact on mental health and well-being, which then has a healthcare effect that then costs society as well in the long run, not just by denying someone's potential, but then all of the impacts and pressures it places on, say, for example, the National Health Service, on housing. It creates a negative feedback loop and a vicious spiral, which actually damages the nation's potential. So I think it's important that we reflect on it not just being about an individual human experience, it's about us as a community, our own resilience and our own capabilities as a collective society being sabotaged as a result. Obviously, we've experienced the last decade or so in the context of declining public expenditure, relatively speaking, budgets which are under severe pressure. And we've seen persistent cuts, disenfranchising communities with high levels of deprivation. We're seeing the closure and reduction of hours of, for example, free services such as libraries, due to council cuts. These are often seen as a quick way to cut costs, but no assessment is made about the well-being impact of withdrawing community-based services that are open to communities at all times. Very often it's an end of financial year panic decision that doesn't really have any serious wider assessment about its secondary effects. And ultimately, someone in the public sector is going to have to pick up the tab for that. So I think a wider, more patient assessment of how we manage public expenditure cuts is critical as we go forward. I mentioned that poverty leads to a disparity in health and social outcomes. For example, provisional national records of Scotland data for this year shows a large difference in life expectancy based on council areas. Male life expectancy is just 73 in Glasgow compared to 80 in the neighbouring local authority of East Renfrewshire. I've heard this expressed most kind of strikingly by the late trade unionist Jimmy Reid when he was filming a TV show for STV in the early 1990s, and he was standing in a field between Glasgow, the housing estate of Drumchapel, and Bearsden, one of the wealthiest communities in Scotland. And as the camera passed across the field, he described that similar disparity in life expectancy. And he was saying it's equivalent to the average sentence someone would get for murder, the difference in life expectancy. And it was quite a striking way to put it, I thought, that actually we're giving people in poorer communities a life sentence effectively for no other crime than having had an accident or been born in a different place, different postcode. That really was quite a striking way of putting it. The damage it's causing, the social violence and vandalism that it causes to us as a society as a whole. And indeed, last year, people in the most deprived areas were 6 times more likely to be admitted to hospital for an alcohol-related condition compared to those in the least deprived areas. 8 times more likely to die of a drug-related death. And indeed, death by suicide was almost 3 times more likely amongst those from deprived areas versus the least deprived. And I certainly saw that manifested in my own constituency, which is why I've been heavily involved in the last few years in efforts to try and have a public health-based approach to drugs in Scotland as opposed to a criminal justice-based approach. Not only is it already shocking that we see such horrendous disparities in outcomes between these different communities based on relative poverty, but also that we effectively are criminalising people for suffering the effects of poverty. And I think that's something that we are making some progress on in Scotland, but it is still painfully slow. For example, we've just seen most recently the approval of a pilot overdose prevention facility in Glasgow. In reality, we need a network of such facilities to help people who are deeply marginalised in society. And the impact cumulatively of this is such now that the Glasgow Centre for Population Health Research, most recently published, has shown that life expectancy and mortality rates across Scotland have stalled in the last decade. And indeed in Glasgow, we're starting to see life expectancy get worse for the first time since industrialisation. A shocking precedent that is now started in Scotland, largely driven by deaths of despair amongst younger people as a result of persistent structural poverty. Further, they also highlight that death rates amongst those living in areas categorised as the 20% most socioeconomically deprived in each country, in each county, are most accentuated. So we are seeing this concentrated death rate within the poorest districts in Scotland. We often talk about the importance of health inequalities, and I certainly take that perspective as the Shadow Minister for Mental Health in Scotland, but it's not something we can tackle without tackling poverty in a cross-governmental way. And a crucial part of that, as I'd mentioned earlier, is tackling in-work poverty. Whilst the Scottish Child Payment is likely to reduce poverty, the growth of in-work poverty is holding back further progress with stagnant wages. We know that just over 10% of workers in Scotland are locked in persistent low-paid work, and by definition of low-paid work, I mean being paid below the real living wage. And indeed, 72% of those low-paid workers are women. So there's definitely also a gendered effect here as well that we need to pay greater attention to. particularly given the more likely caring responsibilities that women have in society. 5 high priority industries play a key role in maintaining in-work poverty: retail, hospitality, manufacturing, health and social work, and the administration and support services. So how we value those roles in our wider economy is important. My party has certainly look at these deeper structural issues by launching a Child Poverty Commission, which will develop a roadmap to meeting the interim final targets on child poverty set out in the Child Poverty Act of 2018, which we're currently not meeting the trajectory on. We need to get back on track in Scotland. It should be the defining mission of any government, and certainly my party are determined to use all the resources we possibly can to make the end of child poverty in Scotland a reality. This commission is co-chaired by Chris Burt, who leads the Joseph Rowntree Foundation's work in Scotland, and hopefully we will be able to move back towards that goal of eradication of child poverty. The last time my party was in government, it successfully lifted 2 million children and pensioners out of poverty, and there is a proven track record of how we can do that. The answers aren't complicated, they're actually devastatingly simple, but we are frustratingly far adrift from it. So we need to get back on track, and hopefully the work of that commission will guide us. But also, as we've heard tonight, we need a process of wealth generation within communities as well. There are some great examples of this in Scotland, most notably in our housing association movement, where we have democratic ownership of assets and the ability to direct and give agency to people. We need to build on existing apparatus in Scotland where this exists. We need to rejuvenate the housing association movement in Scotland and to further entrench its democratic structures. We need to expand that base, and that will hopefully also be a way in which we can improve democratic agency within poorer communities. We also have to look at ways in which we can structurally rewire the economy. A good example of this was the huge exposure people felt when there was a sudden spike in energy prices, and it was largely a huge profit growth in privatised utilities. There are huge opportunities for us to harness our twin crises of a cost of living and climate by building new capacity for green infrastructure that is commonly owned, and the surpluses of which flow back into communities to alleviate poverty and stabilise incomes. And a good example of this is district heat networks, and a promising example of this has already been developed in Clydebank, where by taking energy from the River Clyde, heat from the water of the river, the technology developed in Glasgow by an engineering company is capable of taking the entire town of Clydebank off of the gas grid and power it for all its heat requirements from a municipally owned power station in the town, the profits of which are then reinvested in common public services. These are the sorts of solutions we need to look towards if we are to break the structural problems of poverty in Scotland. It was called before municipal socialism, but we need to rediscover that idea of democratic common control and direction within communities, which has been stripped away over the years. And these are ways in which we can deal with it. It's not all about the automatic stabilisers of the social security system, essential as they are to provide a basic floor of human dignity in society, but we also need to look at how we can restructure communities to give them back economic agency and democratic control in an economic sense, not just in a perfunctory parliamentary sense. So on that basis, I want to work towards the eradication of poverty in Scotland. It's a multifaceted and complex problem, but actually, in many ways, the solutions are simple. Changing our perspective on avoiding the persecution of people who are suffering the effects of poverty is one way in which we can move forward. To stabilise the incomes of the bottom 40% in society is essential, and we can do that through transfer payments in the social security system, increasing average wages, particularly for those at the lowest income deciles. But we can also do it by building resilience within communities and increasing the capacity within communities to have a greater share of the income they generate. And that can be done through processes such as cooperatives and remunicipalising public services. That is a critical way forward, I think. So equipped with all those different strategies and guided by our commission, hopefully we can make a positive impact in the years to come and reach our goal of eradication of child poverty in Scotland. Thank you very much.
Thank you so much for that, Paul. I am now pleased to introduce Holly Irvin, our final speaker, who works for the Wellbeing Economy Alliance Scotland. She's a lead for the Love Leafham project. They are currently in phase 2 of Love Leafham, where they are working with local young people in the area to find out what wellbeing means to them. At the heart of this is the need to advance and protect children's rights in Leafham and work with Perth and Kinross Council to co-design solutions that have the children's wellbeing at the core. There are families in Leafham who are faced with hardship, from financial hardship to feeling unsafe in their communities. They're working across schools, nurseries, and with parents to understand how they can find solutions to the problem of their communities, advance children's rights, and bring the council and multiple third sector and community partners with them. Holly has lived in Leafham for 29 years and grew up in 6 or 7 different council flats in Leafham in a single parent household. She started this role in May after the project had already started, and this feels like a full circle moment for her, being able to give back to the community, especially to the children whom she can relate to on so many levels. Over to you, Holly.
Thank you. Am I on? Yeah, I am. Okay, thank you. So I don't have slides, but I can share some of the reports in the meeting chat after I'm done. I don't have too long to chat either, because I know we've been talking a long time. So thanks for having me, and thank you for hanging around. This is really cool. So Love Leafham is a partnership project between the Wellbeing Economy Alliance, who I work for, and Perth and Kinross Council. It's in phase 2, so that starting right now. So I don't have too much information on phase 2 right now, but I'll just run through phase 1. So phase 1 of the project, we worked with hundreds of children in the local area. So they were youths and primary schools, secondary schools, to understand what wellbeing meant for them and create a wellbeing vision for the area in their community. From this, we done a lot of research and skills-based work with the kids. So we had a children's commission, which was set up across the primary schools in the area. And they became UN detectives, which was pretty awesome. And so they were learning about their own rights and responsibilities as citizens within Leafham and the rights that they have as children. And they done things like researching around their area about different things that was going on. And so it was a big, huge participation exercise, and it was super empowering. And from that phase 1, we created a report. So I'll stick the report into the chat box, but I'm in the middle of rebuilding that report for phase 2, so I can send that out once it's done. And we came up with priority actions. So all the children's feedback, all this information, all this, what wellbeing meant to them, things that came up about, road safety, food safety and food security, access to mental health services, access to transport, trees. They want trees, and they wanted a lot of animals. They want animals. I'm trying to get the council to give us a zoo. So there's a lot of really cool feedback. We took that feedback and we set up an adults commission. So the adults commission was made up of the council, the police, the NHS, all for the local area for Tayside. It was made up of people from the local area who had lived experience as well. And they digested the information and came up with priority actions for the children. But we embedded children's rights in their learning and their skill building. So they were told all about their rights and how to advance it, and that they were able to then almost contextualize their problems within their rights. We brought together adults and council workers to help understand and action their work, and brought the commissions together to work together. And then at the end, we created a list of recommendations and the councils and for the kids, and started to embed the voices in locality planning. So one thing is that, the council have just been really awesome about this project and really advancing what we're doing, and they're in the middle of making their locality plans, and the children's voices have been amplified into what it is that they want to do in the future. From the phase 1, they put a new safety community warden in the area for us. We're getting a Christmas tree, and these are just little bits that came out of phase 1, but they were important to the children. But so phase 2 started when I came on in May, and we're going to take a step further. So 2 key things that came out of the phase 1 were the children wanted to tackle frightening behaviour in the area and elements of safety. Safety was a big thing that came out of phase 1. And there was other issues around healthcare and issues around spaces. So in phase 2, we're going to go a step further, and we're going to deep dive into one key area that from the phase 1. We're building on the work that we've done, which is around children's safety. So we're kind of phase 2 is focused on advancing and protecting children's safety in Letham. We're including the voices this time, however, of infants and toddlers. So we have amazing consultants who are going to be working with children in the area, infants under the age of between 1 and 5. We're trying to understand what it means for babies to feel safe and loved within the community. So babies and toddlers, what they need, and what children's safety means to them. So how we can best tackle frightening behaviour and safety concerns, all of the safety concerns, with long-term upstream preventative solutions that have a long-lasting effect in the community. But Love Letham is more than another consultation exercise within a deprived community, because we are a deprived community. And it's more than just another feedback and consultation exercise. It's there to understand, to contextualise, to facilitate better conversations and on-the-ground action. It's to co-create and co-deliver policy solutions for the council and programmes in the local area that make our children's lives better, and to ensure that adults are listening, advocating and championing for the rights of the children in Letham. And we're going from doing it to, it's a big thing with the council, we're going from doing it to doing it with them, alongside them, making them feel really involved in the work that we're doing, building trust in our community and reinforcing the views and the feelings of the children to the local authority, the third sector and all of the community actors that are currently working in the area, all under this one umbrella of advancing children's safety in the area. Participation is core to building a wellbeing economy, to tackling poverty and to advancing human rights. Article 12, the right for a child to be heard and listened to. Participation allows us to feel dignified. It promotes fairness within our communities. It allows us to build trust. And what we're seeing, I think, in Love Letham is that, participation is no longer a simple case of acquiring feedback on a consultation form. It has to be actively participating in co-design of policy, co-delivery of solutions, giving agency back to those who need it the most. As many people have mentioned today, this element of having no agency when you're poor is something I've felt my whole entire life, and these kids feel too. And participation is everything. It's, it doesn't have to be writing a form. I get so frustrated when it's another consultation where you've got a million things to write out. It's about feeding back on policy solutions before they're implemented, and being able to tell the council where they're doing things wrong. It's attending community workshops or doing skill sessions. So whilst we're working with these children, we're giving them the tools to understand, actually that's my right, and they can call it out, and give them the tools to be able to know how they should be treated and respected, and giving them the tools to understand their local area better and do their own research. So participation is all encompassing. The wellbeing economy movement is about building social justice on a healthy planet, and it is intrinsically linked to human rights. And to quote the United Nations in a tweet today, poverty is not just a lack of income, it is a lack of education, food, healthcare, shelter, political inclusion, choice, safety and dignity. We at Love Letham are building a shared language among our community alongside the local authority. We're putting children's rights into practice, but we're also understanding what they mean in a local context. So it's not just saying, this is what children's safety is and this is what it means. It's like, that can be different in every council area. That'll be different in every part of Scotland. I mean, the general concepts and the ideas will be the same, but the individual parts of it will be different. So it's about understanding what they mean to these children, We're working towards long-term and preventative solutions that the children feel properly reflected in, that the adults want to champion. We're building a collective purpose in Letham to put children's wellbeing at the heart of decision making. Everyone, including children and adults in poverty, adults and children in poverty, all have a huge important role to play in changing this, changing this beautiful world that we live in. So everyone has enough to live life in dignity and fairness. And it's more than just listing human rights to them and then walking away. It's about understanding actually how do we advance these rights so that they result in collective well-being, prosperity, opportunity. And it's understanding what these rights mean to the communities in Letham and bringing as many partners along with us. So not just doing it the council or the wellbeing economy, doing it with all of the other actors within the area that are already doing awesome work. So we're focusing on safety in phase 2, which started in May, but it's kind of over. Well, I came and joined in May, so I wasn't there on phase 1. So we're doing just a lot of. I've come in and changed a little bit things, but we're kicking that off after the October holidays, which will be in a week and a half in Perth. And we're looking at safety in terms of mental health safety, food safety, road safety, and it's coming up by the end of it, hopefully with policy solutions and papers that the council can implement. And they're not going to be the big systematic changes at, the UK and global level or the Scottish level or whatever it is it needs. It's the changes that we can make as a community and the changes that we can make as a council to do something about this, not in 2 years, not in 5 years, not in 10 years, but actually what can the people in Letham do to right now to help these children and start to make those changes to their life. And a big thing that came out of this, we are, in the top 20 or 10% deprived areas. I hate those words in that context, but we are. But what one big thing was, and it wasn't for them, it wasn't just about money. They were compassionate. They talked about mental health access. They talked about they wanted people to get free homes and left them so no one was homeless. The kids that just had this awesome compassion and understanding of what would make their community a better place. And it's really difficult, but really humbling to, if this is the next generation, then we might be all right. But the main word that came out of phase 1 was safety. So whilst phase 2 is still underway, and I'm still trying to map that out and see how it fits. We're underpinning all of our work with children's rights to what we're doing. We are building well-being, wealth, and new local systems. And even if they are only local, that will play a role in tackling poverty in the local area. And whilst we are still at the mercy of national and global systems, building well-being from the ground up alongside the local authority will hopefully see progress. And even if it's one small thing or 2 small things that we can do, then that's better than where we were 6 months ago or a year ago. And hopefully we'll all learn something valuable along the way. Poverty is different in every household. It's an extremely individual experience for every child and every person. For some families, single parent households, some families, it's a child having to care for a parent because they have mental health problems or because they have an addiction. So taking poverty in taking a narrow view of poverty means that, when we start pulling people out of the water, a couple of years later, they end up falling back in. And the next thing you know, teenagers are crippled with debt until they're 35 because their parents couldn't afford to help them through university. So what we're finding is that even focusing on areas like safety or focusing on areas like crime or focusing on areas like mental health, those still start to unpick all the different areas of multiple deprivation. Poverty is multiple. There's multiple elements to it. So it is cyclical in nature, and it's why several approaches to the problem must exist. And, we can't just stick out 3 national policies or 5 national policies and hope that they're going to fix everyone's life, because they're not. And that's a really horrible reality of being on the ground, working with hundreds of children and hearing stories and speaking to kids on the streets and speaking to families on the streets and being involved in these community groups and hearing different stories, and everyone's story is different and everyone's story is so important. And it's like, it can almost feel like a web of untangling things. And it's I've only been in job since May, and I respect people who have worked in this profession for a long, long time, because it is, really difficult. And so obviously we need global change, we need systematic change at the government, we need so many things to happen, but we need also changes within communities and families in the form of participation, and narrative change in how we understand poverty and social justice, and challenging how we do things, what we know about it, in pursuit of new ideas, and new ideas that are designed and co-created by the people who it affects. So I think that's why doing this through the lens of the UNCRC, and when dealing with adult poverty, I've spoken mostly about children, but that's because I work with children, and a lot of the work we do can be lifted and taken to work with adults. My big thing's child poverty, but that this can be done anywhere with anyone, and that's the beauty of it. But it's doing it through a human rights approach and understanding poverty through a human rights approach. It removes poverty from one person's remit. It removes it from one government department, one policy decision, one political party, from one class. It removes poverty from these figures and statistics. It removes it from power. It makes it everyone's business, including children's, and it gives everyone agency over it, including children, because it is fundamentally a human rights issue. And to quote Paul before me, we all have a stake in it. We all have a stake in it. So Love Lebanon Phase 2 is focused on children's safety, and hopefully doing that, we will start to unpick some other things. Safety for these guys is food safety, and it's home safety, it's safety inside, safety outside, it's safety on the roads. We want to let them define, what that safety looks like in Letham. Hopefully, out of it, create localized targets that actually represent the community for the council, and work with the council to bring policy in that helps to not fix it, because we don't have the power to do that. It's too big, it's too systematic, but we can do something. We can do something on the ground to make it better, instead of having to wait for other people to do it. And it will have an impact as well on adult safety, because when children are happy, adults are happy, and that the family unit's happier, and it will impact the whole of the community well-being and community safety and cohesion, and the stories we tell with each other within our community, and all of those different elements. And I think that any progress that we make here advancing the rights will be advancing the rights within our community, and hopefully we're all going to be involved in it, all of us. So I guess that's all I have to say. And I have a little report here of what there we go. I'll send you the page for the phase 1 report. And phase 2 is still underway, so I don't have too much to say about that, but I could come back next year and talk about it.
Thank you so much, Holly. That was just wonderful, and thank you for sharing the report in the chat. I hope everybody takes a second to read that. I think that'll be absolutely brilliant. Just to let everybody know, we are moving into breakout sessions. These will last about 5 minutes, so feel free to prepare any questions you'd like to ask. So thank you. Hi, so I think I don't know if it's just me that's frozen.
Oh, just realized the video is not on. I'm just staying here just in case anyone has problems.
Right,
But it
okay.
looks like everyone's joined, which is
Okay.
good. So yeah, I'll move on to mine.
Okay, what one should I join?
Number 2.
Okay, good. Thank you so much.
No worries. See you.
See you. think it might be only our breakout room that's moved back.
I'm sure it'll work itself out.
Yeah, I'm sure. I think it gives everybody 30 seconds to like, hop out.
Yeah.
I've never used the breakout room before. I was like, what's happening? Where am I going? Where are they taking me?
Yeah, 100%. Okay, so I hope everybody's back now from the breakout rooms, and I hope everybody enjoyed that. We're going to move on to our Q&A session now, and if you have a question for any of our speakers, please put up your hand, and Hannah and Will, our Q&A hosts, will get to you. So, yeah, just come at us with your questions. It'd be good to hear them. Thanks.
Hi everyone. Just first off, I'm just going to ask one of our questions before anyone jumps in, and please feel free to type your questions or put your hands up. But one of the questions that we had, just for whichever speaker feels that they would like to answer it, was one of the things that we as individuals or as a community can do to help eliminate poverty or take some steps towards eliminating poverty. So it's quite a broad question, so you're very welcome to come in however you like. I could actually ask Brian to start off with just so we can start.
No problem. I think the main thing we can all do in our communities is raise our voices. Don't ignore it. For too long, poverty's been hidden. And the people who suffer poverty are the ones who try to hide it the most. In my community where I grew up in a lot of poverty. My father died when I was very young, so my mother was left to bring me and my sister up on her own. And pride, shame, these all things go together, the emotions, and you don't talk about it. We need to talk about it because it's getting to the stage where people are suffering and children are suffering. So yeah, raise your voices.
Thanks, Brian. I'll hand over to Paul.
Yeah, I think it's recognizing that poverty is still a deeply stigmatic issue in society, and there is a mental health crisis that's highly correlated. It manifests itself, as I described earlier, in addictive behaviour often. And what I discovered in my work with people who use drugs in Glasgow was that often it was about anaesthetising yourself to the misery of daily existence. It wasn't necessarily a consciously destructive behaviour. It was a self-medication exercise because there was nothing else to help. So in terms of the individual in society, if you have the capacity to give of yourself to help others, I think it's maybe just recognising those vulnerabilities in people in your community, but also looking to help build capacity to assist in some way. And I don't think it doesn't necessarily need to be in a sort of judgmental way. It can often be about building capacity and wealth within communities. An interesting example of this is the food pantry network that's been established in Glasgow, trying to supplant food banks, which are often seen as a shameful and stigmatic thing, with a more cooperative-based approach, which is about sharing our common wealth. These are the kind of differences we can make that not just improve self-esteem, but also improve our common wealth and the resilience of a community as a whole. So I think ways in which we can build cooperative ownership of wealth and share that with each other will help build resilience and improve people's sense of worth.
Thank you very much, Paul. I'm going to pass to Tia.
Yeah, my question's for Christine. How much do you think human rights plays a part in the ideas behind how women access medical gynecological care?
This is something that we've been working really hard around with Claire McGilvray, and yeah, we've identified a lot of sort of human rights breaches, and especially with the plans for Scotland to take in new human rights laws as well. I think we're going to breach even further. So women have a right to safe local healthcare, and we're not getting it, and it's terrifying what's happening up here.
Thank you very much, Kirstine. I actually had a question for Paul, who touched on how the looking at restructuring of the housing association movement. I was wondering if you could talk a little bit more about that. in view of eradication of poverty?
Yeah, it's actually about defending what we have as much as building capacity in many ways. A good example of a case I'm dealing with in Glasgow just now is one of the pioneer housing associations in the city of Reedvale. So in the 1970s, Glasgow Corporation, as it was then known, wanted to demolish hundreds of tenements in the Denniston district of the city. The local community came together to fight back against that ostensible project to improve housing, eradicate poverty, but they recognised that it would have a destructive effect on the wider social environment, the kind of intangible aspects of what makes a community. They fought to successfully save their tenements, renovate them, and sustain the heart of their community. What's now happening with the connivance of the Scottish housing regulator is that a large London-based corporate organisation is trying to acquire the housing association and asset strip it by taking basically the ownership of all these tenements in Denniston and leveraging them for debt finance, which they'll then use to build what is known as, curiously, as mid-market rent properties, which are largely unaffordable for people in the lowest incomes. So it's actually an active process of destroying democratic wealth and further acting regressively. So what I'm saying is, it's not just about not just about building capacity within the housing association movement, improving its governance. It's about protecting what we have. But the reason why Reedvale's become so weak and vulnerable to this attack is because there hasn't been the capacity within the community to renew the board, to renew the governance of it from the community. So we need to improve that confidence and training and capacity for citizens to step up and take ownership and manage their assets. And otherwise we will see them fall apart and be stripped away. It's just one example of a kind of immediate kind of joust that I'm having, but it's symptomatic of a wider process that unless citizens step up and defend their ownership of assets, they'll be stripped away.
Thank you very much, Paul. There's some links in the chat where people are talking about this UN Special Rapporteur for the Right to Housing, about finances, companies buying up social housing. It's really interesting. Brian?
Yes, Paul's going to be popular tonight. I've got a message to say. A question for Paul, if you don't mind, Paul. Last year, we saw that the UK government stepped in to stop the Scottish Parliament enabling into an act for them, the incorporating the UN Convention on the Rights of the Child into Scots law, so that all future legislation to do with children would have to comply with the principles of the convention. The UK government stopped that. I know there's an impetus within Scotland and the Scottish Parliament to try and widen the scope for implementing the human rights into Scots law by bringing in the full UN declaration. At a UK-wide level, is there anything that we can do, or hopefully the next election brings in a more socially empathic government who can actually bring in something similar to what we try to do in Scotland, in the Scottish Parliament, where we can incorporate either the UN Declaration or at least the UN Convention on the Rights of the Child into UK-wide law, so that it protects all children and all adults.
Yeah, it was a deeply frustrating situation that I think it's commonly called culture wars, that increasingly the relationship between the Scottish and UK governments has been characterised by antagonism rather than cooperation. And this has been one example of how this has played out. There are some technical reasons why there was a dispute that arose about the legislative competence of that piece of legislation, which could have easily been worked through and amended. It was a relatively technical series of issues. And I think there is a process going on to do that, but it was handled in such a unnecessarily aggressive way that we've ended up in this kind of impasse at the moment. But I'm hopeful that we will see a revised amendments addressing that particular piece of legislation in the coming months, and I understand the government ministers are working on that privately. But it's been an unnecessarily confrontational process, and I don't think it needed to have been like that. But I think you're right about the wider need to incorporate the UN charters, in legislation as an underpinning. We just talked about housing rights, for example. is a critical process of that. And it's actually an interesting point about what is governing, for example, the Scottish housing regulators' approach to the right to housing. It's probably not, what the UN Special Rapporteur is recommending. So let's look at how we can further align our public policy in Scotland with the UN directorates. I think that would be really good. So if any further insights that you might have on that, I think it would be useful. One thing I would say about the Scottish Parliament, which is very good, is its Public Petitions Committee process, which I had the opportunity to serve on. So you only need one signature to trigger a public petition in the Scottish Parliament. So if you have any particular, proposals about how the Scottish Parliament can respond to these ideas, I would encourage you to use the Scottish Parliament's public petitions route. And one signature can get it heard in the Parliament. You can encourage your MSPs to go along and speak in favour of these things, and to encourage the government to respond to it, which they have an obligation to do. And it can even lead to a public hearing. A recent example of this was transvaginal mesh implants, and getting redress and justice for women who were affected by that. That was done through the Public Petitions Committee. So it is an effective way of getting things on the agenda in Parliament, and I would encourage members here, if they are so minded, to use that route if they think they've got specific ideas that can improve public policy and bring it into alignment with the UN directorates and their declarations, not just on child poverty but many other aspects of public policy.
Thank you very much, Paul. I was unaware of that, Riggs. That's a really good thing to highlight. Jerry, do you have a question?
So sorry, Jay, and sorry, Will. But Sandra's question has been sitting in the chat for a while. So I just thought to raise that before we missed it completely. So sorry, Sandra. I think you're addressing this to all the speakers, but correct me if I'm wrong. Sandra says, can we link our minimum wage to an area's median rent? And can we push central banks to please remember full employment was once their main job? So I'll pass that on to our speakers. Yes, Paul.
I'm more than happy to offer a view if anyone else is wanting to go, but that you're bang on. We've discussed the issue of the role of the firm in society in the breakout area, that it's not just about maximising profit for shareholders. It should have a wider social function in the well-being of communities. A good example of how this can work is the Mondragon cooperatives in Spain. The biggest cooperative ownership structure in the world, much more socially just and democratic in how it governs business. But a wider sense that central banks shouldn't simply be concerned about controlling inflation. Yes, excessive inflation is socially destructive, but there are many other things that are socially destructive as a result of excess profits. For example, we know that the bulk of inflation generated at the moment has been as a result of excess profiteering, not because of wage demands from workers. So I think there's a wider perspective needed from macroeconomic policy in the UK. We've been living in the shadow of an inflation-eccentric government since the 1980s, and I think we need to sort of move away from that sort of monomania on inflation. And in terms of a minimum wage, it is a complex area because I understand that the functioning of the minimum wage legislation has to be a universal one across the UK. But there could be opportunities to vary it. We know, for example, in London, there are variations according to the higher living costs in London. So maybe there is an opportunity to vary it somewhat. That would be an issue about reforming employment law, which is currently reserved to the UK Parliament. So if there are specific economic studies or proposals there, again, it might be interesting to feed that through to the public petitions route. Although it's not within the legislative competence of the Scottish Parliament, it's certainly something that the Scottish Parliament could look at, perhaps, and also consider approaching the Scottish Trade Union Congress about it as well.
Thank you, Paul. Brian, are you providing an answer to this question as well?
Yeah, it was, as Paul said, it was something we were discussing in our breakout room. And one of the things that I could never understand, for the last decade, if not longer, it seems like when it comes to the minimum wage, we're chasing our tails, where you get at the start of every parliament, yes, we're going to raise the minimum wage, which is great. But what happens is the companies who are affected by it raise their costs. So what happens then is that the minimum wage increase is wiped out. So you then get increased demands for the minimum wage to go up or for wage increases, and that is chasing our tails and doesn't help out levelling out inflation. I've often wondered why respective governments have never brought in legislation to, especially to the big mega corporations who are making billions upon millions in every quarter, that they can't immediately raise their prices so that it can give the chance for the minimum wage to kick in, so that the people who are receiving the higher rate now can get the benefit of it. And it's trickle-down economics, as Liz Truss keeps saying, where it's trickling down, where the people who get the minimum wage are going to spend it in the communities, which is going to generate more money, and on, instead of this stupidity of chasing our tails.
Thank you, Brian and Paul, for answering that. Jerry, could we take your question?
Yeah, I have a question for Holly, which is, first of all, a kind of technical question related to the consulting,
oh dear,
the not as bad as it sounds, related to consulting on the safety needs of infants and very, very young children. I'm just curious as to how, first of all, how are you going about doing that? Just kind of out of interest. But then secondly, in relation to that, more generally in the topic of safety, like to what extent would you say that safety and poverty are interconnected, and how are they interconnected in your neighborhood? Like, what's your experience of, does poverty drive like antisocial behavior, for example, which leads to less safety? Like, how are those two things connected?
Okay, so the consulting part, I'm not doing that. I'm not asking babies what's the state feel safe and loved. There's this awesome consultants that we're working with called Star Catchers, and they do it through art and play. And it's not about, and I don't know the ins and outs, we've not started that element of it, and there will be kind of methodologies put at the end of it. What we're doing in our participations, actually, the methodologies that we're using are quite, they've not been used, I don't think, in Scotland before. So they do a lot of work with parents and talk for parents and social workers and early years workers and nurseries and all that sort of stuff. But they also work with babies and infants and toddlers, and they do art and creativity with them. I don't actually know how it works because we've not started yet, but I'm really excited to see that. How does safety link to poverty? Well, I'd probably only be giving my opinion on that. Crime and poverty, I guess, crime specifically and poverty are intrinsically linked. I think children under the age of 16 have no way of accessing money, really, unless because they aren't able to get money themselves. So they're shoplifting, or they're on the streets arguing or fighting or nicking stuff off each other and things like that. But it's not just that, it's loads of different elements. And you come from a family that are maybe criminal, and then you end up in that same route because that's all you've ever known and all you've ever learned. And I think as well, safety for the kids is not just been about crime and antisocial behaviour. I hate the word antisocial behaviour, so I try not to say it, but it is antisocial behaviour. It's like food safety. They talk about food safety a lot. So whatever that, we have to find out what that means to them, and it's 100% linked. And what I think the next part is how we find out how it's linked, and mental health safety as well. So they talk about that a lot. And they talk about drug and alcohol issues a lot, and we all know that addiction and poverty are closely linked as well. So they talk about maybe needles or things like that on the streets, or not having a designated space where there's no adults in the area, things like that. And it's all cyclical. I think it's all intrinsically linked. I don't think there's one thing that makes poverty happen, I guess, but that's probably my opinion, really, because we haven't actually done the phase 2 research yet, and I'd be able to answer that question much better in about 12 months. If that helps.
Thank you very much, Holly. Just because we're conscious of time, we're just going to take Nikki's question as our last one.
Hi, thanks very much. So my question really links back to the challenge that we were talking about in our breakout group with the shift of wealth from the public sector to the private sector. And I suppose it's a rhetorical question really to say, how do we make the private sector responsible for part of the solution? They operate in these communities, so how do they cooperate in these communities? If you think back, a number of years ago, when we started talking about the climate crisis, and it being an issue across the world, and it was a long-term problem for the world as a whole. It gave big companies a focus, and they actually set themselves and were set targets for responding to that climate crisis. And I just wonder whether it's now is the time, just picking up on Brian's point about, don't let's raise the profile of this and make it a world crisis, or certainly a UK crisis, Scottish crisis. And how do we force the private companies to actually play their part in the solution?
I guess I've got a little answer to that, and it's only for a community level. But in Lethen, we have 35 private businesses and entities. So that's why we set up the Adults Commission, and we invite like maybe 10. This big commission, it's got the council, it's got lived experience, but it's also got 6 or 7 different private businesses, just local, and it's not huge, but if it makes a dent in a local area, and then you kind of keep working on that, then that might help. But that's all I have for that part.
No, and I guess that's a great model, Holly. So, and in all the examples we've been given tonight, there is fantastic work going on locally. And how do we actually raise that to Pan, Scotland, all these little pockets of activity, and everything that's being done is just so positive for all the right reasons, and very, very constructive work. So, using the model that Holly's talking about, how do we actually make that, so the big banks and the big oil companies actually feel they have a responsibility for making a contribution to the poverty crisis?
I think that one's above my pay grade.
Do you want to say something just quickly, Brian?
Yeah, I think it's going back to my point where if we can get the UN Declaration of Human Rights incorporated in some form into UK law, it would mean that these big companies and companies are held accountable. For example, there's been talk in the last few months of the supermarkets where there's a suspicion of them profiteering out of the cost of living crisis, and why are the foods gone up so much, especially the basics that people have to live on. If we incorporate some form of the UN Declaration into UK law, then they are held accountable. Where you can see, where's the dignity where they put out their saver range, but you're limited to 1 or 2 items per range? Where's the dignity in that? There is accountability in why you're raising your prices. It's okay for big supermarkets, for example, to be tokenistic, where you can leave food there to go to a food bank. But are they not part of the problem with their high prices that people have to go to food banks? So that's just my own personal thoughts.
Thank you. Thank you very much, Brian. Well, just on time, thank you for everyone for participating in our roundtable on eradication of poverty in Scotland to mark the UN Elimination of Poverty Day. Thank you to all our speakers for sharing their powerful messages and experiences and highlighting the key issues and their concerns, and for all your support in our roundtable for change. We've heard how poverty is a violation of human rights for those subjected to it, and it is clear from the speakers tonight that poverty can have huge detriment to people's human rights, from mental and physical health, such as the cutting of health services and mold, heat, and other accessibility issues within flats, as well as seeing poverty as a violation of human rights is one way to move towards the eradication of poverty. This is something we'll focus on our next steps. We're going to have an event in Parliament on eradicating poverty in February to continue to look for solutions on how to eradicate poverty, and we'll provide more details closer to the time. We're also going to provide links to support groups in the chat. If anyone needs help or wants to get involved further, then please feel free to follow the links or reach out to the emails provided. I will now pass on to Aoife to conclude.
Thank you so much for that, Will. And I definitely do echo everything that he has said. First of all, thank you to our speakers. Thank you for giving your time. Thank you for helping us to facilitate this conversations, bringing more light to things, and just giving us food for thought, really, as we go away and we think more about what is happening in our communities and how we can get involved. As Will said, we do have an event in February 2024, so please do join us to continue that conversation. But for more information about UN House Scotland and for more information about the human rights team, I will put a link in the chat, and that is our website. And also, I will also put our email in the chat, and we would love to hear your feedback about this event, or if you want to stay connected with us so we can send you updates on what we're doing and other roundtables that we are taking. Apologies that this has ran over, but it just shows you how important a discussion like this is and how we don't like to cut it short or miss anything out. So thank you, Hannah. Thank you for putting that in the chat. So with that, I say good night and thank you so much for everyone who came to join. Have a wonderful evening.
Thank you.
Thank you, everybody.
Bye.
Bye.
Thank you. Bye.
Thanks.
Bye.
Bye.
Fantastic.
Yes, thanks everyone. Just thank you everyone for your wonderful work. And I'll stop recording now.